So, faith and health related. Professor Koenig, who's speaking to us, completed his undergraduate education at Stanford University, his medical school training at the University of California at San Francisco, and his geriatric medicine, psychiatry, and biostatistics training at Duke University. He's board certified in general psychiatry and formerly boarded in family medicine, geriatric medicine, and geriatric psychiatry. He's on the faculty at Duke University Medical Center as professor of psychiatry and associate professor of medicine, and is the director at the Center for Spirituality, Theology, and Health. He has over 570 scientific peer-reviewed academic publications, nearly 100 book chapters, and over 55 books in print or preparation, and is co-leader of the team training all US Navy, Marine Corps, and Coast Guard chaplains on spiritual readiness for combat operations by US service members. So, Professor Koenig, it's a delight to have you today here on ICMDA webinars, and we really look forward to what you have to say on the subject of our health and faith related. Thank you.
Thank you, Peter. I'm very excited to be here today to speak to you all. So I'm going to be talking about the connection between faith and health. First of all, I will give a brief introduction, then focus in on the research. That's really what I do a lot of. I do a lot of research, a lot of review of other people's research, and I also see patients. So I'm a clinician, I'm an active in a geriatric clinic at the university. Then after talking about the research, I'll present a model to help explain the connections between faith and health, then provide some conclusions and provide you with some future resources. Now I have about 60 slides and we have about 30 minutes. So I'm going to be moving pretty quickly. So let's focus on mental health for now. Some of you might want to identify where this research is coming from. And so the Handbook of Religion and Health, the 3rd edition, is coming out in December of this year. It will have all of the research that I talk about. Some of the research on mental health is the academic press book below. And then in the British Journal of Psychiatry Advances, we have a couple of articles that review the research in the mental health area. So let's start with depression. Depression is the most common psychiatric disorder that you are likely to see in medical settings. And it's one of the most disabling conditions in the world, second only to heart disease. So religious involvement is related to less depression in the majority of studies, over 60%. It's related to faster recovery from depression, and it's also been shown to be effective in terms of reducing depression in randomized controlled trials. Now, of the studies that have been published, now this review is all of the research that has been published since the 1800s. And this work is in the 2nd edition of the Handbook of Religion and Health. So the systematic review of the quantitative research that I'm going to be talking about is in the 2nd edition of the handbook. The 3rd edition is coming out, as I said, in December. But of those 444 studies published in peer-reviewed journals, about 6% report that religious people actually experience more depression. So again, this is a systematic review, and it reports on all of the research out there prior to about 2010. I will also be talking about some more recent research published in the last 10 years. And here is one of those studies. This is a study out of the Harvard School of Public Health. It is a up to a 6-year follow-up study of about 10,000 young adults, average age 23. And after controlling for about 24 different predictors of depression, what they found was that those attending religious services at least once a week were about 30% less likely to experience a depressive disorder over that up to 6-year period. So that's a large random sample of young people, average age 23, and Harvard School of Public Health published in the International Journal of Epidemiology. Naturally, lower rates of depression may reflect in terms of suicide. And what we find is that exactly, that of the 141 peer-reviewed published articles on religion and suicidal thoughts, suicidal attempts, and completed suicide, about 75% of studies show that there is less of that among those who are more religious. Here are some more recent studies. This was published in the British Journal of Psychiatry, over 20,000 national random sample of adults in the US. This is part of the NHANES study. They controlled for gender, age, size of household, previous suicide attempts, and marijuana use. And after that, they found that the likelihood of completing suicide during this 18-year follow-up was about 94% lower among those attending religious services twice a month or more often, compared to those who were not attending religious services. Here's the Nurses' Health Study, 90,000 women in the United States, followed for 14 years, with the likelihood of completing suicide approximately 7 times higher among those who never attend religious services. And then after controlling for dozens of other risk factors for suicide, there was an 84% lower risk of completed suicide during that 14-year follow-up among those attending religious services at least once a week. Once a week seems to be the threshold. Now, this is another large study, 66,000 women. These women were followed for 16 years. These are US health professionals. And what they found is they're looking at deaths of despair. Now, these are deaths from drugs, alcohol, or suicide, finding a nearly 70% reduction in risk of a death of despair among those attending religious services, once again, once a week or more. And there is a P for trend in this data that is highly significant, which suggests that the greater the dose of the religious attendance, the lower the likelihood of dying from a death of despair. It actually is supportive for a causal relationship, i.e., religious attendance causing lower rates of deaths of despair. It's suggestive, it's not proof, because only a randomized controlled trial can provide proof, but it's as close as you can get with observational data. This is a study of male health professionals. This is actually, these are not physicians, they're dentists, pharmacists, optometrists, osteopaths. A nice sample, 43,000, and they were followed for over a quarter of a century, 26 years. And what they found was an approximately 50% lower risk of dying from a death of despair among those men attending religious services once a week or more, similar to the results found in women. And again, you see this P for trend in the data. Let's go on to look at substance use disorders, alcohol use, abuse, dependence. Again, the vast majority of studies, almost 9 out of 10 studies, show that religious individuals are less likely to use alcohol, less likely to abuse it, and less likely to become dependent on it. The same is true for illicit drug use. Again, 8 to 9 out of every 10 studies show less drug use, less drug abuse, and less drug dependence. And if you look at randomized controlled trials of religious or spiritual interventions, you find that 95% report significant benefits from religious or spiritual interventions. This is a more recent study. This is an 18-month follow-up study of about 500 US adolescents. These young people are ages 11 to 16. These are young people who have been referred to child protective services because of abuse in the home. These young people have been neglected, they've been abused, and consequently, they are at very high risk of developing a substance use disorder in their future. And this is an 18-year follow-up of those young people at high risk for substance use. What this study found was that those youth who said that religion was very important in their lives were about half as likely to develop a substance use disorder over that time, compared to those who said that religion was of little or no importance in their life. This was looking at anxiety and PTSD. So of studies published prior to 2010, about half found that religious people are less anxious. They're more peaceful. And if you look at the 11% of studies that found higher levels of anxiety among religious individuals, these were, almost all of them were cross-sectional in research design, which means that in cross-sectional studies, you don't know whether it was the anxiety that was causing the religion or the religion that was causing the anxiety in those studies, finding a positive relationship. However, we are pretty sure that it was the anxiety prompting the religion, because when people get anxious and they're in a difficult situation, what do? They pray, they turn to God. And consequently, what we're picking up, I think, in this 11% of positive relationship, we're picking up the causal direction of turning to religion when you become anxious. And this is backed up by the experimental study or clinical trials, of which over nearly 75% find that a religious or spiritual intervention actually reduces anxiety symptoms. Now, this is a large random sample of US veterans who've been in war, a little over 3,000. And this is a cross-sectional study, but it provides information on PTSD, a common condition found among veterans and active duty military. I do a lot of work with active duty military as well as veterans. So in this particular study, they used our Duke Religion Index in assessing religious involvement. It consists of 5 questions, and you add up all the scores, and you can then divide them into high and low religiosity. And what we find is that those with high religiosity compared to those with low religiosity are about half as likely to report having experienced PTSD in their lifetime. And if you look at current levels of PTSD, you find that about 70% report are people who are highly religious are about 70% less likely to report current PTSD. Now, I've been talking about some of the negative health effects. Let's talk a little bit about the positive mental health. So well-being and happiness. Most of us are driven by simply the desire to be happy in life, to be satisfied with their life, to have well-being. And consequently, about of the 326 studies that have objectively looked at these relationships, about 80% find that religious people are simply happier. They're more fulfilled in their life. They have greater psychological well-being. And interestingly, of those 326 studies, less than 1% report lower levels of happiness among the more religious. Meaning, purpose, hope, and optimism are all more common among those who are more religious. Over 90% of studies show that those with a religious faith have greater meaning and purpose in life. About 3/4 show that they are more likely to be hopeful. And over 80% indicate that religious people are more optimistic about the future. And having meaning and purpose in life, being hopeful, being optimistic, that has consequences for patients' motivation for self-care and efforts towards recovery. So if you have a religious patient, they are probably more likely to be motivated to recover and work harder to do so if they get sick or if they have a surgical operation or have a stroke or whatever, because they have more meaning, more hope, and more optimism. So these are not just, intellectual kinds of findings. These really have clinical consequences on the ground. Social support. Religious people have more friends. They have more social contacts. Over 80% of studies indicate that they report more social support in their various daily activities. Delinquency in crime is lower among those who are more religious. This should not be surprising because all major world religions encourage people to live by moral standards, to develop their character, not to hurt others, to become involved in delinquent or criminal activities. And consequently, over 80% of the currently published research shows inverse relationships with religious involvement. Marital stability and satisfaction also is higher among those who are more religious. Greater marital stability, less divorce, greater satisfaction in the marriage, less spousal abuse, less cheating on one's spouse, and more likely to have an intact family with two parents in the home, which is very important for young people. So that's found in 86% of research. Again, all of this research is published in peer-reviewed academic journals. And bear in mind that traditionally, science journals have been negative towards religion or faith because of the deep divide between science and religion. So it's remarkable in many respects that you find all of these studies reporting positive relationships with religious involvement, with faith, in academic journals that have been traditionally hostile towards religion. Here's a more recent study out of the Harvard School of Public Health, 14-year follow-up of 66,000 initially married women. So these women were all married at the start, followed for 14 years, and risk of divorce or separation was examined. What they found was nearly a 50% reduction in risk of divorce or separation among those attending religious services regularly. And again, you see this P for trend suggesting a causal relationship. Trying to understand this overall, this is a model from the 3rd edition of the handbook, showing that religious involvement, attending religious services, praying, scripture study, volunteering for religious reasons, religious education, religious devotion and commitments, and religious coping affects mental and social health across the lifespan, from the prenatal environment all the way up through a person's later years and as they approach death. And all of this is influenced by genetic factors as well as by gene environment interactions, but it does seem that across the lifespan, religious faith makes a difference. Let's look at health behaviors quickly. Religious people are more likely to exercise. Now, the only problem is that they are more likely to be heavier. So religious people actually eat better diets. They eat better diets, but they eat too much of the diet, consequently are more likely to be overweight. So that's an area that needs some work. However, religious people are less engaged in extramarital sex. They're less likely to engage in risky sexual behaviors in 80 to 90% of studies. Again, not surprising, but important consequences. Cigarette smoking. As physicians, we all know that smoking is not good for your health. And in 9 out of 10 studies, research shows that religious people are just less likely to smoke. They are less likely to start smoking, more likely to quit smoking. And consequently, what are the health effects? Less heart disease, less lung cancer, less chronic lung disease, better health. Here's a more recent study. This is out of Europe, actually. This is nearly 24,000 adults over the age of 50, and they were followed for a period of about 10 years. This is the Survey of Health, Aging, and Retirement in Europe. You can see here that religious individuals are 40% less likely to smoke. They're about 20% less likely to use alcohol. They're about 50% less likely to have no moderate physical activity. They're about 40% less likely to have no vigorous physical activity. Weight, it's a draw here. And they're also less likely to have sleep problems. So religious people sleep better. Physical health consequences. There are many. Religious involvement is related to better immune function. So that's pretty important in this day and age of COVID-19 and all of the variants. So religious people have stronger immune systems that are more likely to fight off infection, cancer, all of those things in general, in more than half of the studies. Better endocrine functions, lower stress hormone levels, and not surprisingly, then better cardiovascular functions, lower blood pressure in about 60% of studies, better cardiovascular functions in terms of heart rate variability, C-reactive protein levels, in about 2/3 of studies, and overall less coronary heart disease in about 2/3 of studies. Here's a study, once again, out of the Harvard School of Public Health. The Harvard School of Public Health is the top research institution with regard to public health in the world. And they do very, very good research. This is a 12-year prospective study of 44,000 women without hypertension to begin with. And this is self-reported development of hypertension. And you can see here, there's about a 10% reduction in risk of developing hypertension among those who are attending religious services at least once a week. And again, you see this P for trend in the data. Consequently, there is a lower risk of death from cerebrovascular disease, from stroke. So you can see here that those attending religious services to any degree have significantly lower risk of dying from a stroke compared to those who never attend services. Again, this is a 16-year prospective study of about 75,000 nurses, published in JAMA Internal Medicine. Here is looking at, actually, this is in Iran. I do a lot of work with researchers in Iran, as well as in Saudi Arabia, the Middle East, and different areas there, as well as China. And in this study, they matched 190 hospitalized patients with coronary heart disease with 383 controls, showing that those scoring overall highest level of religiosity have about a 70% lower likelihood of having coronary heart disease. Again, consistent with research in the US, in Israel, and in other countries. Listen, this is looking at cognitive functioning with aging. So this was a study of people with Alzheimer's disease, 64 patients. It was a 12-month prospective study. It was published in Current Alzheimer's Research, finding that there was about a 6 to 7 times greater likelihood of showing a decrease of 3 points on the MMSE, the mini mental state exam, among those with low religiosity in this study. So it appears that religious involvement may in fact slow the progression of Alzheimer's disease. And that is actually consistent with community studies. This is a 12-year prospective study of 1,160 adults aged 50 or over. This is the US Health and Retirement Study. This shows that there is a, interestingly, episodic memory appears to decline more slowly with aging among those who pray, but not among those who meditate. So whether you spend your time in meditation or whether you pray to God, for example, does make a difference. Here's a study of ADL impairment. Again, this is the European study, 9-year prospective study of 14,000 adults in Europe. Again, finding about a 25% lower likelihood of developing activities of daily living impairment, functional disability, about a 25% lower risk among those who are more religious compared to the other respondents in the study. Mortality from all causes is lower among the more religious in close to 70% of studies. More recent research, again, out of the Harvard School of Public Health. This is published in JAMA Psychiatry, 75,000 women followed for 16 years. You find overall a lower risk of about 1/3 of mortality during that 16-year follow-up. And then you see, again, this gradient of effect, suggesting that religious attendance is actually causing lower mortality. This is true for heart disease, not surprisingly, again, with the gradient of effect, as well as true for cancer mortality. Once again, a gradient of effect. Now, this is a study with regard to young people. This is the young, nearly 10,000 people sample, young, average age of 23 years old. This is up to 6-year prospective study. This shows a significantly lower risk of developing cancer among these young people, between a 60 and 70% lower risk among those young people attending religious services at least weekly. So, and this is after controlling for 24 different covariates, along with correcting p-values for multiple comparisons using the conservative Bonferroni correction. So these researchers tried everything to eliminate this association, this predictive risk, and they could not do it. They still ended up with a nearly 60 to 70% lower risk of developing cancer among these young people. What's interesting is that there is actually a potentially genetic cause for this. It appears that religious involvement is related to lower levels of inflammation, which are related to lower levels of this cancer gene. And overall, what this means is that there is a positive relationship between religiosity and cancer suppressor gene. So religious people are more likely to have a gene that suppresses the development of cancer in this particular study. This was published in 2019 in Social Sciences and Medicine. So the relationship, kind of summarizing here and ending, the relationship between religion and health in all studies, you find here a number of studies. This is a summary. This is out of the handbook, the first and second editions of the Handbook of Religion and Health. You find a few studies showing complex relationships, about 250 studies showing that religious involvement is related to worse health, nearly 250 studies, a few studies showing a trend in that direction, about 250 studies showing mixed results, about 100 studies showing a trend towards a positive relationship with better health, mental, physical, social, and behavioral health. And then it's pretty clear that most of these studies show that religious people are healthier across the board, mentally, socially, behaviorally, and physically. And a few studies showing no association. So this is the model that we use. This is for monotheistic religious traditions. The source of these benefits is belief in and attachment to God. In other words, people who are manifesting the theological virtues of faith in God, hope in God, and love of God. This is nourished within a religious community. It's influenced by peers and education, and it's manifested in terms of public practices, private religious practices, religious commitments, religious experiences, religious coping, which then affect decision-making, health behaviors, health maintenance, screening behaviors, compliance with treatment, and also influence these human virtues, which are associated with positive emotions, social connections, and that help to neutralize negative emotions, all of which influence nervous system, immune, endocrine, and cardiovascular functions, which affect physical health and longevity. So quickly, applications of the clinic. Health professionals should take a spiritual history, talk with patients about these issues. Respect, value, support the beliefs and practices of the patient. This needs to be patient-centered. Identify the spiritual needs that patients have. Ensure that someone meets those spiritual needs. Usually that's going to be pastoral care. Pray with patients if patients request, and work with the faith community, again, if the patient requests. A lot of this is in spirituality and patient care, and I'll show you the book later. So here's an example of a spiritual history that should be taken on all patients, particularly those with chronic health problems, especially during the initial history. Do your religious or spiritual beliefs provide comfort, or are they a source of stress? Do you have any beliefs, religious beliefs, that might influence your medical decisions? Now, that's pretty important to know. Are you a member of a faith community? And if yes, is your faith community supportive? And then finally, do you have any other spiritual concerns that you'd like someone to address? So this is out of the Journal of the American Medical Association, JAMA, from about 20 years back. And then besides taking a spiritual history, support the religious or spiritual beliefs of the patient. Ensure that the patient has resources to support their spirituality and accommodate the environment to meet the spiritual needs of the patient as necessary. Now, if you want to know more about this, we have 5 CME qualified 45 to 60-minute training videos on how to integrate spirituality into patient care. This was the result of a project that cost well over $100,000 to $200,000. It was supported by the Templeton Foundation, and these are very, very well done videos by a Harvard-trained media specialist. Did this, there are 3 for physicians, 1 for nurses, and 1 for the spiritual care team. So just go to this website. If you don't get CME, they're for free. If you want CME, then you have to pay for it. Okay, in conclusion, religious involvement is related to better mental, social, and behavioral health, and improves these aspects of health over time. Religious involvement is also related to better physical health, less functional disability, and less cognitive decline as a person ages. These findings, when you think about them, these findings have huge public health implications and implications for healthcare costs. especially as religious involvement becomes less in common with each younger generation. So that's certainly being seen in Europe, and we've seen it in the United States here too, and really all over the world. It seems as though science is becoming more important to than religion, and unfortunately, that's having consequences. So some further resources. If you want to know about the latest research coming out every month, just sign up for our website, for our newsletter. This is for free, comes every month. I write it. I review all of the research and then write it and then send out this newsletter, the latest research, latest news, latest resources, events, even funding opportunities for those who want to do some research. Here's the book, Spirituality and Patient Care, 2013. This is the third edition of this book for clinicians, specifically for physicians, as well as other healthcare professionals. And then if some of you might get interested in doing research, well, we have 5 days here at Duke where we've compressed a 2-year postdoctoral fellowship into 5 days. And we train people on how to do research, how to understand the research. We have people who are in high school, in college, who are getting their PhDs. We have professors from Harvard, Stanford, Johns Hopkins attending this workshop. And we have a stellar faculty. And again, if you're interested, just send me an email and I'll show you. We also have some partial tuition scholarships and even some full scholarships for those from underdeveloped countries, including Russia and different areas, China, etc. If you can attend our research workshop, then here's a book that basically summarizes what is taught in the workshop. And you can get that, and that'll give you some good information on how to do research in this area. Research in Europe and other countries of the world is desperately needed in this area. Most of this research is coming out of the United States and Europe, but we need more research in other areas of the world. Here's our website, lots of good resources, most for free. Just go to it, spiritualityandhealth.duke.edu. And now we have a time for discussion.
Well, thank you very much, Professor Koenig. What an overwhelming amount of material and all pretty much pointing in one direction. So thank you so much for summarizing that for us so adeptly and presenting it so comprehensively. And we're sorry we could only give you half an hour to do it, but you've done incredibly well. So we've been listening to Professor Harold Koenig on the subject of Are Faith and Health Related? And we now have a time of Q&As. Now, Professor Koenig, a number of questions coming through on the relationship of different faiths. And I wonder if you could just give us an overview, how much of this research is on Christianity, Judaism, Islam, and so on? Could you give us a breakdown of that? And that would lead on to the other questions, or the obvious other question, is there any obvious difference between the faith groups in terms of the effect of religious behavior on health? So the first question about where the research is coming from, which religions have been studied.
Yeah, so that's a very important question in terms of the generalizability of the results. So from a strictly scientific standpoint, probably about 90% of this research has been done in Christian populations. That's simply because countries like the United States and United Kingdom and Europe are more likely to have money to be able to support research in this area. So that's basically it. 90% of the research comes out of Christian populations and certainly is generalizable to that population. Now, other religions also appear to have relationships with better mental health. People from different faiths who are devoutly religious in their faith tradition seem to have health benefits. Now, the big question is comparison. And those studies are almost impossible to do. simply because of cultural differences, because of different stressors that people experience from different faith traditions in a faith majority country. So we don't really have good comparison studies. The question though is, do people who see God as personal, do they have more benefits from their faith than those who see God as distant or not as personal? So, we don't know, but, just from a logical perspective, one would think that belief in a God that came to earth, died for us because he loved us, ought to have health benefits. So, again, that's not a scientific statement, but just logically, one would think that would be true.
Yes, and it ties in with your comments about the research on meaning and purpose, hope and optimism, as well as being important indicators. Could you comment a bit for us? You've hinted about this already, about the geographical distribution of research. Is most of it coming from the US and Europe? And if so, why is that? Or what are the other areas? What's the essential breakdown distribution, if you like?
Yeah, most of the research is coming out of Christian countries. The US, probably the vast majority, but also Europe, and Brazil also. The Middle East, I do a lot of work, as I said earlier, with Iranian and Saudi Arabian investigators looking at Islam and the benefits that Islam has to health. And it's pretty similar to the benefits that Christianity has to health in terms of the actual findings. Research out of China. In China, the relationships are weaker simply because, Christians in China are under more stress because they're going counterculturally. So that has health effects as well that are not good for a person's health. But in any case, that's the geographical distribution. Very little research out of Russia, a little tiny bit out of the Ukraine, but not much at all out of Russia. We need more research out of that part of the world.
Interesting your comment about China and persecution, because intuitively we might imagine that people with an active faith would be under more stress from persecution or isolation, alienation, rejection because of their faith, and that this might have adverse effects on their mental or physical health. Does that show up in the research? And if so, how?
Yes, it does. It does. And, although the findings are mixed here, with regard to mental health, it seems as though there's a greater risk of suicide and greater risk of mental health problems among those who are more religious in China. But also, if you look at the one very large data set of people over the age of 80, this is actually the largest prospective study of people over the age of 80 anywhere in the world. You find that those who are more religious in China have greater longevity and they have a slower decline in their cognitive functioning. And that's based on just one question, and that was, do you participate in religious activities? Yes or no? And if they say yes, they live longer and have slower cognitive decline in that large sample of people over the age of 80 that's been followed for, I think, 2 or 3 decades now.
Now, in a lot of the studies that you presented, the measure of religious activity has been religious attendance, and the key figure of 1 or more attendances per week. Why is it that that's the measure looked at? Is it because it's more easily objectively measurable? And why do you think it has an impact on health? Is it its correlation with other factors relating to faith, or is it somehow the attendance and being together with other religious people?
Yeah, so, there is no question that attendance at religious services, involvement in a religious community, is the most powerful predictor of mental, physical, social, and behavioral health. There's no question about that. Mm-hmm. And one reason, as you actually indicated, is that it's easier to measure. Usually these large data sets that follow large populations over time don't have a lot of room to include a lot of questions. And so they include one question. Most of these investigators are not interested in faith and health, interested in something else, but they throw in one question on how often do you attend religious services as a kind of social proxy. And consequently, we have these findings that are very, very consistent and reproducible. Now, why is that the case? Well, actually, religious attendance is a package of different things. It's a package of different things. First of all, for someone to just say they're religious is one thing, but to get up in the morning on Sundays and to get dressed and to go to religious services, that's showing that your faith makes a difference in your life, that you're willing to do something about your faith. So that's one factor. The other factor is that it involves physically being active, physically getting up, showering, getting in the car, parking the car, walking to the service, and then sometimes being very active in the service, kneeling, standing, or raising hands or something, or bowing or whatever. All that's physical activity. And then on top of that, it's the social interaction. And then there's the praying together. There's the singing together. There is the listening to the sermon and getting advice about how to live your life. All of that affects a person's health. Now, social factors are important, but they only explain about 25% of the effect. Means 75% is related to other things, including faith, perhaps the majority being faith.
You mentioned earlier you've done some research in the Middle East, and we've got a question here specifically about Islam. So Kenneth Tan, who is an Indonesian medical student doing a clinical rotation in obviously a Muslim majority country, more Muslims in Indonesia than any other country in the world. Some of the Muslim patients I interviewed, he said, have reported feelings of guilt as they view their disease as punishment from God. This has made me wonder, is there a significant difference in health outcomes, physical, mental, or social, across the major world religions? How does Christianity compare to other worldviews? And I guess that's quite a complex question because there are many factors involved there. But in faith communities where disease is seen as a punishment from God, has there been any research done on that and knowing its effect upon health?
Yeah, a number of studies have come out of Indonesia showing quite robust relationships between Islamic practices and beliefs and better health. There's no question about that. Now, in terms of guilt, yes, there's an issue there, but on the other side of that is that many people who get sick, who are Muslim, devout Muslims, actually use their sickness as a way of compensating for the sins in their life. Because in Islam, it's about the scales, your good deeds and your bad deeds. If your good deeds outweigh your bad deeds, you go to heaven. It's very simple. If your bad deeds outweigh your good deeds, you go to hell. Very simple in Islam. So many Muslims will actually not take pain medication or may actually suffer intentionally with illness in order to raise the good deeds, to do it in a way that will compensate for their bad deeds. So that's one issue there. Now, the guilt certainly doesn't help. Certainly doesn't help. But the belief in a loving, caring, forgiving God would appear to be more healthy. On the other hand, Islam believes in a merciful God. Every single verse, the first verse of every chapter of the Holy Quran begins with merciful God. And merciful in Islam is another word for loving. So, people are different. And yes, you can have guilt. And yes, Islam is about the scales. It's not about like Christianity. It doesn't matter. It's about Christ, what Christ has done for us. It compensates for everything. But so that's how it works. That's how the Islamic faith tradition works. And in Indonesia, yes, boy, we need more research out of Indonesia. But comparison studies, they're not going to show that Christians are healthier than Muslims simply because they're a minority group and under tremendous pressure.
Thank you. Now, you mentioned in your applications of this research the importance of taking a spiritual history. And there's a question here, is there a good resource you can recommend on that? But also a follow-up to that, how many medical schools are actually teaching how to take a spiritual history as part of their courses? And what do you think is the way of raising awareness about the need to do this more effectively in medical education?
There are many different spiritual histories that have been presented. You should be able to get a PDF of the PowerPoint slides that I just showed you. We have one in JAMA that's been published. I think it's probably the most reputable one. It's about 4 to 5 questions. And that's the one I would suggest simply because, it's more credible. It's in the top medical journal of the world, JAMA, arguably the top medical. Of course, the Lancet is also, so don't want to push this too much. But in any case, in the US, approximately 10% of medical schools have required courses on spirituality and health in medicine, about 10%. We actually interviewed all of the deans of the medical schools in the United States and published a paper in 2010 that looked at this. And so about 10% have required courses. About 1/3 have elective courses that medical students can take or not take. And about 90% say that they have something in another course related to spirituality and health. Now, that can be virtually anything. But in terms of actually taking a spiritual history, I think that probably about 10 to 15% of American medical schools are actually doing that.
And finally, you're doing some fantastic work on training people into how to do research in this area. And of course, you published on this in this area as well. And you've reminded me to tell people that we will be sending out to everyone who's booked to this webinar a PDF of the PowerPoint. So they're going to have all these references there. But I just wanted to ask you in closing, Professor Koenig, what do you think are the main areas now going forward where more research is needed into the link between spirituality and health, and perhaps to inspire some of those starting out in their careers who might make this an important part of their practice? Where are the gaps?
There are gaps right now in virtually every conceivable area that you can think of. We are just on the very edge of this area becoming mainstream. And with the 3rd edition of the handbook, I think it will be a major boost to it becoming mainstream. I have 2 Harvard investigators as my co-authors. The second author is Tyler Vanderweel, who is probably one of the world's top statistician. He has a degree in mathematics from Oxford University. He's a PhD in biostatistics from Harvard. He's a world-renowned statistician. He writes the books that statisticians. He's second co-author on this handbook. So I think that's going to move it into the mainstream. But there is virtually every area, especially if you're not in the United States, and if you're in another country. There is so much need for research in different countries of the world, looking at these associations, between religion and health. And there is so much opportunity for a person who is motivated and who is, really motivated and interested in learning how to do research, to conduct research and look at these associations in different countries, different population groups, even different religions. So I would strongly encourage anybody who is interested in doing research in this area to contact me, and I will kind of point you to our 5-day research workshop or one of our books, or tell you about some of the scholarships that are available to bring in promising investigators into this whole area of research.
Well, it's a great invitation and opportunity and challenge to people. Thank you so much. Look, I'm going to sneak in one last question, which has turned out to be very popular on our Q&A, and that's the question: is the data on the efficacy of biblical counseling approach to mental illness? It's perhaps a little bit outside this field, but what one would certainly wonder, given the strong link between faith and health.
There's every reason to think that biblical counseling, we call it religious or spiritually integrated psychotherapy, and counseling is helpful. And we've done a randomized controlled trial showing that it's at least as equal to cognitive behavioral therapy. So there's a lot of research out. There is a recent review, I think it was 2018, by a colleague of mine, where she reviewed all of the research. It begins with a C. I can't remember her last name, but it clearly shows that that religiously, spiritually integrated or biblical counseling has benefits that are at least equal to secular counseling, especially in those who are religious patients. If you do it in non-religious patients, it's not going to work so well. But if you have Christian patients and you do some Christian counseling, that's going to work. And there's one of the largest organizations in the world, larger than the American Psychological Association, and about double the size of the American Psychiatric Association, is the American Association of Christian Counselors. Mm-hmm. And they are having their world meeting in Dallas, Texas in September, and I'll be there. So it's a growing area, particularly for those, who are interested in doing that.
Well, and there's another wonderful challenge and encouragement to people as we finish. So we're delighted, Professor Harold Koenig, to have you on ICMDA webinars today. Thanks so much for your presentation, for your comprehensive coverage of these issues, for your answers to the questions. We could go on talking for a lot longer, but we haven't got that time. But just thank you so much for your service to medicine and your service to the church as well. And please be encouraged in the work you're doing. It's many more people every year are becoming aware of it, and it's making a huge difference. So thank you so much. Thank you to
Peter.
All of you who've joined us today. Thank you very much for coming, making this a success. Thank you to Professor Koenig, and we look forward to seeing you again soon on ICMDA webinars. May God bless you. Thank you.